Hello, everyone. So I decided to wear my Justice Democrats shirt today because we're talking about healthcare and Trumpcare, and it's such a disaster. Excuse me, and it frustrates me that Medicare for all is just not being as talked about as it should be. I mean, it's not a stated position of the Democratic Party, and it needs to be soon. I say this all the time, and there's a bill actually in the House that's being proposed called H.R. 676 by John Conyers, and I believe Bernie Sanders is putting out his own kind of legislation, but I mean, he's in favor of single payer health care. So um, this bill has 113 co sponsors, and it used to have 121 House of Representatives congressmen not supporting it. So now that number is down to 84. 84 representatives that don't support this bill. So you can see over time the numbers do matter. It really comes down to this is a massive wave of popularity on this issue of healthcare, trying to ensure that everyone has a right to health care and that they're actually going to receive care. Because that's, I hear a lot of people that are more centrist, like Bill Maher, who I've now had to have like every feeling that I could think of because he's just all over the place. But anyways, he's like, oh, Obamacare was all about making sure that healthcare was insured as a right. Well, no, it's not, because it's still a private system. You're still going to have people that slip through the cracks. You're still going to have people that are just uninsured, and they're going to die. So there's no other way around that. Until you decide that we're going to go for a single-payer system, we're going to always have that problem. So, like Obamacare is maligned often, I think, unfairly. So that being said, though, it's not perfect. So we have to still actually fight for more. We can't just settle for the establishment, and that's what the Democrats would love to do right now because. I don't know. I think they just capitalize on being anti-Trump, basically. That's all it is. They think that enough will basically get them to where they were, I guess, under Obama. But we're going to have to actually talk about real issues here. It's about the Democrats not being able to stand up for things, and they're perceived as weak. They just are. I mean, people hate Republicans. Like they are for deplorable things, and I've said, yeah, like these things are truly horrendous and unforgivable, and a lot of people are seeing that. The Trump era is kind of exposing the Republican Party for how far right it is, but at the same time, the Democrats, they just refuse to fight the right way, and that's a big problem. This is my position that I have, on healthcare. I'm for single payer, unapologetic about that. But beyond that, I'm just kind of noticing a trend. I'm noticing that our politics is changing, and you don't hear about it as much as you should. I mean, you have to really dig into these things, see the nuance of what's going on, and honestly, it's coming from both sides. You have to analyze both sides and not be partial to either one of them. So here's the deal with the AHCA, the American Health Care Act, I believe it is, which is the repeal of Obamacare, and it's just largely not what it says it is. It's not about healthcare so much at all. It's about cutting taxes for the rich. There's only so much that we know about this bill. I mean, we have the House bill to go through. The Senate bill, I believe we're seeing things about it come out now. And they're saying it's meaner or whatever. I mean, I haven't looked like at the legislation. I haven't read through it. I'm only going based off congressmen who have read it, what the news is reporting. But we know, I mean, the Republicans, that they're fighting to have flexibility on opting out of certain regulations, so certain things that are meant to protect people in getting health care. And we see them making these arguments. It is out there in the open for everyone to read. Okay, so I mean, we know, and the experts say, like, it's just horrible. They're trying to kind of slip past this. The Republicans, they're trying to, rush this as much as possible. Not let a lot of data show up about all these things that they want to do, because they know if people get word of that, it's not going to be popular, and they're going to get so much pressure they can't vote for this. So basically, they want to get a bill out there so quickly they're just going to vote on it without even reading it. Now, people criticize that with Obamacare. It's so big, it's a pile of paper, they never read it. So it is not exactly uncommon for this kind of thing to happen. But, you do have to keep in mind here, Obamacare was passed in 2010, okay? It was passed a year after Obama took office. It had a month of debate in the Senate, in Congress, let's say. I'm not positive if that was specifically the Senate, but let's say, a month of debate in Congress. And then that's also on top of committees that, they go through everything, and they're basically, it's just oversight to make sure that they don't leave anything out, cross all the, what's the phrase? Dot all the I's, cross the T's. That was the one. So the Republicans are all mad about that, about what they did with Obamacare. Oh, they jammed that bill in there. Now they're saying with this, I don't know. They just ignore reality. This is so you can't not see these things. It baffles me that people can't see the hypocrisy. So basically, there is nothing positive being offered up. It's about cutting services. It's for a very key reason, too. You have to understand that the Republicans want to do this through reconciliation. This is, parliamentary tricks. They only need 51 votes. But in order to do this, you have to make it deficit neutral. So that means you have a certain budget, you can't go over it, right? So how are they going to get all these tax cuts through on the rich? And we see them. It's essentially Reaganomics. They want to get this through, honestly, because it's like one kill two birds in one stone. The Republicans are having trouble passing legislation, essentially just because they're so unpopular. It's honestly, you see this kind of disorganization on both sides, but in this case, the Republicans, their ideas are so bad and people are seeing it, so it's very tricky what's going on. Anyways, you compensate for these massive tax cuts on the rich by cutting services like Medicaid. And it's massive, massive cuts, in the billions of dollars. So you're creating a situation like you saw in 2008 where you had, the Great Recession, and these things, they're all, very interconnected. Like, as Bernie Sanders says, healthcare is 1/6 of the economy. So we're headed to disaster if we have a fiscally irresponsible policy in place. And this is why, honestly, like, I kind of sympathize a little bit with people that are like on the far left, whatever, like they couldn't vote for Hillary because lesser of two evils. Yes, I accept that. I accept that she's the lesser of two evils, and that, to me, like admitting that is not a, it's not a reason to not vote for her. Like the worse evil obviously is more evil. I know it sounds like kind of morally ambiguous, whatever, but you go down the list of issues. Hillary, as flawed as she is, she's just not the same as Trump in all these very key areas. Climate change is another big example. I know that Hillary doesn't exactly care if she promotes fracking all over the world. Seems to be okay with her because she does it. But, she's not a crazy person like Trump, basically. So, that's that on that. We go to Vox now. And they wanted to straight up ask Republicans, like, what do they want to do with this bill? So keep in mind, we deserve better answers than just get rid of Obamacare, premiums are too high. What I'm saying is, the Republicans have been talking for 8 years how Obamacare is a failure, Obamacare is a failure, we're going to do something, we're going to fix this crisis, okay? So what are their ideas? Like, this has been ruminating now for a while. So what are they going to offer up? So, as I pull this up, it's just amazing to me because you see people that are even like John McCain, who's like this respected Republican. Oh, he's a maverick. Ooh. Well, he's not a great guy because he's just, I don't know, he's freaking complacent in this crisis where we're considering throwing even more people off health care than are already not getting care. So let's get to the real quotes here. So Tara Golshin of Vox asks John McCain, generally, what are the big problems this bill is trying to solve? John McCain, almost all of them. They're trying to get to 51 votes. Tara, policy-wise, what are the problems in the American healthcare system this is trying to solve? And is the bill doing that right now? John McCain, well, it's whether you have a full repeal, whether you have a partial repeal, whether you have the basis for it, it's spread all over. Tara, but based on the specifics of the bill you have heard so far, is it solving the problems? McCain, what I hear is that we have not reached consensus. That's what everybody knows. Tara, right. But outside of getting the votes, from what you hear of the actual legislation being written, is it solving the problems you see? McCain, it's not being written because there's no consensus. Tara, but generally speaking, what are the big problems it is trying to solve? McCain, you name it. From the repeal caucus, which, as you know, they have made their views very clear, Rand Paul, etc. And then there are the others on the other side of the spectrum that just want to make minor changes to the present system. There's not a consensus. So, yeah, they're not organized. That seems to be true. Or they're not in agreement about what to do with healthcare. But you would think there's got to be at least some kind of semblance of a problem that both these sides in the Republican Party are trying to solve, and they have different ways to do it. But like what is the actual problem here? Well, I can tell you, yeah, whatever the number is, I'm not sure off the top of my head. Americans are uninsured in like the tens of millions. The Republicans, if you ask them and you really like press them, like, how do you solve this? They're gonna give you all kinds of things like the private market's gonna solve it. We're gonna let insurance companies, or you can buy insurance across state lines. You can let insurance companies do whatever they want and not insure you if you have pre-existing conditions. These are things that people like Ted Cruz actually believe. or they say they believe. I don't know. These things are crazy, and no one buys it. It's such a small percentage of the population that is actually that crazy. Okay, so now we go to Chuck Grassley, this like 150-year-old senator who is like very revered as a conservative intellectual, whatever. Jeff Stein, I want to ask a very broad question. What do you think this healthcare bill will accomplish that will improve America? What's the positive case for this bill? Chuck Grassley. Well, I can tell you what it's going to do for Iowa. We are one of those states that in a couple of weeks, if the insurer Medica pulls out, we'll have 94 of our 95 counties won't have any insurance, even for people who have the subsidies. That's what we have to concentrate on now. How do you think the bill will fix that problem? Well, by bringing certainty to the insurance market. They don't have that certainty now. By bringing certainty to the insurance market, what certainty? What? What do you mean by certainty? Well, they can't even file. They have to check the rates real high if they don't know what the government policy is. And so the certainty is that passing a bill gives the health insurance companies certainty. Would not passing a bill also do that? No, well, yeah. It gives them certainty that you'll have a lot higher rates than if you pass the bill. So you're saying the bill will lower the rates. If you're talking about lowering the rates from now down, no! The rates could be way up here. Points to the sky. And if we get a bill passed, it maybe wouldn't go up or would go up a heck of a lot less than they would without a bill. By rates, are you talking about premiums? Yeah, premiums. Sorry, I have to go. Oh, it's such a comedy. Such a comedy. So those are the only two I'm going to read because it's just a clown show. So they have no idea if it's going to make insurance more costly, if it's possible, it's going to go up, but still not as much. That's what we had under Obamacare, okay? The rates were still going up, as they always do, but the rate at which they were increasing was slowed down. You can see, when you look at the actual data, that's what it showed. So these people are so whacked out, and they just deny reality. I'll say that through and through all the time. So single payer, I believe, is inevitable. A freaking ex-Bush official is on the same page with me when I say that. So that tells you that something is happening in this country. It won't be easy, though, because there's a lot of resistance coming from all over and within the left. I mean, Governor Brown in California is fighting this healthcare bill, and he made sure that he's not going to get it on his desk. I just read a report today that said that it's being held up now in committees, so it's going to be dead, basically. It's not going to go forward. So it shows you that politics is hard. Legislation, doing these things, is no easy matter by any stretch of the imagination. But you have to fight for these things and go on the talk show circuit like Bernie does. If you're a true liberal, if you consider yourself a progressive, then you have to be for these things, and unapologetically so. But that ends up not happening a lot of the time because people in these wealthy classes, like even Obama is guilty of this too. They don't fight for the right ideas, and it's often because of shady business connections. That's just how it works. So that bill in California, is pretty much dead. It passed the Senate. Brown is not on board. He says he doesn't know where they'll get the extra money. At a state level, I understand that argument has a little bit more validity because, states are states. It's not federal. To have enough money. I mean, California is a big state. Maybe you could pull it off. But I mean, regardless, it's just more of a reason to fight for single payer, nationwide. At least, have a public option. You have to alleviate the suffering. Because biggest cause of bankruptcy in this country, is medical bills. So, I mean, Hillary ran by saying, her position was to move to the public option. That's not good politics, because that's the position that maybe you arrive at after debate and compromise. The position you take at first should be single payer. That's the true liberal position. And people will say, like, oh no, you can't do that. You're gonna alienate people in rural states or whatever. And then again, as I've said time and time and time again, how do you explain the fact that Bernie gets these Trump supporters in West Virginia all over to cheer on this idea? And look, the research shows it's not just anecdotal. Pew Research shows that a majority of Americans are in favor of single payer. So, as the public perception shifts, true change happens. We see this in a marijuana policy. It's becoming more and more popular now to legalize weed, and so you see more and more places starting to legalize. So, it's a very similar thing that's going on with healthcare, basically. The real hurdle is making the argument in the right way, as I've said before, because you have to do it in a way that explains to people, like people use scare tactics and be like, oh, Bernie's a socialist, ooh. Well, understand what socialism is. I mean, like, our country has socialist aspects in it already, okay? We have a public military where citizens, enlist. We don't hire freaking assassins and mercenaries like on the private market. Our police are funded through tax dollars. These are socialist constructs, and through the state. And all progressives are saying is that healthcare as a for-profit industry is not sustainable. And it's immoral. At the end of the day, we're going to constantly have a tug of war here. I mean, we can maybe make things better if we get to a point where, let's say, a public option gets passed, and we're able to insure more people. We'll get that number of uninsured down. That's the best you can do, right? Just get it down as low as you can. You're not going to do that through capitalistic methods, because, and it's just demonstrable, because our system is unlike the rest of the modernized world. The rest of the modernized world is more socialist than us, and we do terrible in this area. So shouldn't it show you that, like, a lot of these same ideas are not going to work? It should be so simple, but it baffles me how people just can't put two and two together. So the main point I want to leave with here, it's funny, I didn't talk too much about Trump in this video. He's kind of out of this healthcare debate. I mean, he checked out because healthcare is too complicated. I don't know anything about that. I mean, I'm not a politician, but that's why he voted for me, because, like, I'm not one of the corrupt people, even though... Oh, okay, never mind. So the point is, it's not enough to oppose Trump. It's not enough to oppose the Republicans. We got to do that. We got to show them that their ideas are dumb and are going to be very dangerous. But if we only do that, my fear is that people are just not going to buy into Democrats anymore. It's going to be a lot like Republicans in 2012. They cashed in on all this anti-Obama stuff. Like the whole Benghazi thing, and they were trying to pin him on that, and like, oh, you didn't call it an act of terror. So, in like the Tea Party, like, this is what I'm talking about. Like, it just was all over the place, and I believe that the Democrats could be perceived in that way, that they're just going to be viewed as like, oh, they're doing all this for political gain. They don't really care that much about helping people. They just want to, oust the Republicans. So you have to change that perception. I believe the only way to show that that's not the case is show the American people, yes, we care about you. We're not just going to continue down the same path. We're not going, because Obamacare, yes, we accomplished a lot there. That's great. But we have to go further. We're not going to give up there. We got more work to do. Like, these are the kind of things that Obama would say all the time, except now we've forgotten about that. We're in a different era now. So I'm just saying, like, don't abandon your principles just because you're getting discouraged by Trump. Basically, it's not all about tearing everything down. I mean, you have to try and build upon things. Like, that's truly what's important in this.